The worst part of my job as a plastic surgeon is when my patients get complications. Yes, bad things can happen when you perform plastic surgery, and I'm going to share with you two situations that absolutely freaked me out as a doctor. If there is a doctor who says that they don't get complications, that doctor is lying to you. And sometimes these complications can freak out even the most experienced surgeon. So many patients come to see me with puffiness under their eyes that they want to get rid of. And the surgery to remove it is usually very simple. It's called a lower blepharoplasty, where what I do is I make an incision on the inside of the eyelid. I tease out fat from the 3 lower eyelid fat compartments to remove that fat and to basically depuff the eye. So I performed this surgery along with the facelift on a patient who was in her early 60s. The surgery went very, very smoothly. There was very minimal bleeding, and as is our usual custom, I had her spend the night in the hospital to monitor her blood pressure, to get her up and walking, and to make sure that she was doing fine. Well, the next morning I came in to see her, and this was how she looked. Now, she didn't look exactly like that. She didn't have both of her eyes crossed, but one of her eye was looking straight and the other eye was crossed in. Would that freak you out? Well, one of the most feared complications of blepharoplasty surgery is damage to one of the eye muscles. There are muscles that surround the eyeball that allow the eyeball to move in different directions. And when we're doing surgery in the lower eyelid, there are 2 muscles down there, the inferior oblique and the inferior rectus muscles, that technically can be cut during the operation. And if those muscles are cut, it can cause the eyeball to move in the wrong direction. So I'm staring at her and my stomach drops. And I ask her, Judy, not her real name, do you notice any changes in your vision? And she said, no, Dr. Youn, I see fine. And her friend was sitting next to her, and I asked her friend, I said, does Judy look different to you? And she looked at her and she said, not really, which astounded me because here I am looking at somebody whose eye is completely crossed. So I said to her friend, I said, take another look closely at her. Does her eye look crossed to you? And she said, well, actually, now that you say that, I do see that it looks crossed. She goes, what's going on, Dr. Youn? And my thought is, I performed the operation very smoothly. There was no sign of any problems. Why is this happening? So then I thought, well, maybe this was how she started out looking and I just didn't notice it. So I told the patient and her friend, excuse me, I'll be right back. And I ran out to my car where I had her chart. I opened up her chart hoping to see a picture of her with a bit of a crossed eye, and maybe I just didn't notice it. And it wasn't crossed. Her eyes both looked straight ahead. So I went back to her room and I said, Judy, something went wrong and your eye is crossed and I don't know what's going on. I need to call an ophthalmic plastic surgeon to see what we may be able to do with this situation. And I left her room and immediately called a colleague of mine, Dr. Diane Schlachter. Now, Dr. Schlachter is an ophthalmic plastic surgeon. She's an ophthalmologist who's specially trained in plastic and cosmetic surgery of the eyes. So I called her up and I said, Diane, this is Tony Youn. I need your help. I've got a patient who I performed a blepharoplasty on, and one of her eyes is literally crossed. And she said, well, Tony, does she have double vision? And I said, no, her vision is fine. And she said, Tony, don't worry about it. She probably has a history of strabismus, where she had an issue with crossed eyes when she was younger and eventually trained her eye to look straight. And what has happened is you injected some local anesthetic into the area of some of the muscles, and that has caused the muscle to go back into what it was doing before. But because she's had it in the past for so long, her vision has compensated for it. And I said, okay, this makes a lot of sense, Diane, but what do I do? Is she going to be cross-eyed now for the rest of her life because of the operation that I did? And she chuckled and said, give it a week, and when she comes back to see in a week, I guarantee you she's going to be fine. And 1 week later, the patient came back to see me, and I rushed into her room because I thought, oh my gosh, please tell me that her eye is fine, and her eyes were straight. Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest and scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me. Several years ago, I performed a combination of a tummy tuck and liposuction surgery on a real nice patient who was in her 30s. And this surgery took me about 5 hours. I removed a lot of unwanted fat from her and did this tummy tuck operation. Now, even though the surgery was long, it went very, very smoothly until she called me up 5 days after surgery. It was the first thing in the morning. I was in the operating room about to start an operation when my patient called me up and said, "Dr. Youn, I'm freaking out. My right leg is twice the size of my left, and it's purple and it really hurts." When patients call up with concerns, usually these are things that we've heard about before. I've got some redness around my incision, I've got some swelling. These are things that we can typically deal with often over the phone. But this one was a bit concerning. So I sent her to the emergency room and continued with my surgery. So in the back of my mind, I was hoping that within about an hour, the emergency room doctor would give me a call and tell me, "Hey, no problem, Dr. Youn. Your patient is doing great. She's overreacting, and we're just going to have her put her leg up and it should be fine." So about 45 minutes after my patient and I talked, I received a call from the emergency room physician. And the first thing she said to me was, "Dr. Youn, this is really bad." Now, the patient went to a hospital that was in a different community than where I lived in, about 45 minutes away, because that was the closest hospital to where she lived. So I talked to this emergency room doctor, and the doctor said, "I've never seen anything like this before. Her one leg is literally twice the size of the other, and it's mottled in color. It doesn't have good sensation. It doesn't have good blood supply. I think she has a terrible blood clot." As I'm listening to this, I feel this flushing going on in my body as my stomach drops. One of the most feared complications of surgery is getting a blood clot. And I would argue that this is one of the most common causes of death after plastic surgery. I got on the phone with the emergency room doctor and they said that she has massive blood clots all throughout her leg, something that they had never seen this severe before. She was literally at risk of losing her leg. As her surgeon, I felt terrible. There was that thought in my mind of, if I did not operate on her, would this be happening to her? The emergency room doctor told me that they were going to send her directly to interventional radiology, where a radiologist was going to assess her to see if he may be able to perform a clot removal procedure on her that was actually experimental at the time, to see if he could open up the blood supply to her leg. Now, I did not have privileges at the hospital, so I parked in the visitor section of this hospital and I ran into the entrance and asked where interventional radiology was. And luckily, the interventional radiologists and their assistants were kind enough to let me actually be there and to watch as they were performing this very advanced procedure to try to remove the blood clot from her leg. Now, because I was not her physician in this hospital, I was not allowed to take any type of role in her patient care. So all I could do was watch helplessly as this doctor hopefully tried to save the leg of my patient. Well, after about an hour or so, the radiologist came out to talk to me. And he said, "Dr. Youn, I've never done this procedure on a clot so bad before, but it was successful." And over the next 2 hours, I watched the patient and I talked with her, and I could literally see her leg shrinking down in size. I could see the color coming back to it. And thank God that this interventional radiologist had the skill to save my patient's leg. Well, I found out later that the reason why she developed a clot is not so much that I performed this operation on her, but that she had very unusual anatomy of her legs. And so after this all happened, she actually said, "Dr. Youn, Thank you so much for acting as you did and for sending me to the ER right away and sending me to the right place, because now I know that if this happened in a different place at a different time without the same resources, I may have lost my leg. Sometimes we perform what we consider to be routine operations and bad things can happen. And other times we perform surgeries that are super difficult and even really risky. And at those times, I have sometimes felt a higher power actually helping me out. Take a peek at this video right up here where I tell the story of a patient whose surgery was so difficult and so risky that I actually felt God's hand guiding mine in the operating room. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.